In this demo, I will be demonstrating how to do the syncope station, which is part of the skilled Osces. Well, you will walk into the exam room and you will find a script written on the screen mentioning that you have given a patient the LA and you just turned your back to wash your hands, and when you turned your head back you found that the patient, you just given him LA and he now just fainted or lost consciousness or whatever. You're supposed to manage and write a report. The two things here worth mentioning to help you differentiate between a syncope station and a CPR station. First of all, here you will find the, how do you know it's a syncope? Because the mannequin here will be on the chair. Of course, the mannequin will be different than mine here. It will have full legs and clothes and stuff, full body mannequin. You will find on the bracket table the examination kit, the examination instrument, and you will find a local anesthetic injection, which you're supposed to have just used to give LA. So that's how one way to find out this is syncope, not CPR, because in the CPR the mannequin will be on the floor. Number two, the script itself didn't mention the word CNOs. It just said fainted or lost consciousness, while there it will be telling you clearly that there was a syncope, that there was cyanosis. Okay, that's number one. So how do you act? Once the 10 minutes starts, what do you do? Well, here I'm using a video on a patient, but it's the same to be applied on a mannequin. First of all, you will check for the consciousness by holding the patient from the shaking their shoulders, shouting their name. If no response, and then you immediately shout for help, not call an ambulance kind of help, but rather call for help from a nearby person, like a receptionist. So help, I have a patient who just lost consciousness. You see, here we say lost consciousness. We didn't say not breathing. It's just loss of consciousness. And then you quickly act, go to the control panel, put the patient in supine position, but don't put the head in lower than the heart, and just lift their legs. Whatever was available to lift their legs, use it, and just check the vital signs. You need to check the vital signs. Now, of course, this detail is extra. There won't be emergency kit given or anything. So that's basically what you just do. You shout the patient name, whether they are conscious or not. And then you immediately, quickly call for help, put the chair in supine, lift the legs, all right, and check the vital signs. And that's just basically what you are going to write in the report. In a matter of less than a minute, the patient should regain consciousness. Probably the examiner will be telling you that he just or she just regained consciousness. Now that's your signal to move on to writing the report. There will be a notebook and a paper on a desk and a chair for you to sit down and write your report. Now, what should your report include? First, you're going to write the patient name. That would be taken from the scenario. And age. Whether there were any medical history given, you should write it down. You just describe what happened. For example, The patient lost consciousness after I gave him local anesthetic injection. And then you write down what have you done. You write, I stopped the treatment. I checked his responsiveness by shouting his name. I immediately made the chair in supine position, and that's probably the most important thing here. And I raised his legs. I called for assistance meanwhile, and I kept on monitoring his vital signs. The patient regained consciousness after 1 minute or less than 1 minute. I maintained him in a supine position. I have rescheduled the treatment for another time, or as you know, whatever the patient decide. I have made sure that the patient's vital signs are stable before he was dismissed. And that's it. That's it. That's all you need to write down in your report.